Dr. Christine Schaffner, thanks for joining me today.
Oh, thank you so much, Jason. I'm so excited to do this interview.
Yeah, I've come to know you through Dr. Dietrich Klinghardt. And, when I have spoken with him and talked to him about the cases, I mean, you guys work on some of the most complex cases that I think I know of. These are the people that have so many things going on with them. They're so sensitive to things like electromagnetic fields or chemicals or, anything in our environment. And so, I know that the presentation you got today is going to be very impactful and probably something that most people don't think about. And that's what I really, really love about what you've got for us today. So why don't you share with the audience a little bit about maybe what you're going to be talking about?
Absolutely. And I'm really excited. And as you mentioned, I'm going into you're working with Dr. Klinghardt, and we sometimes take a poll of how many patients, how many doctors patients see before they see us. And it's on average 20 to 25. And, I always reflect and am so humbled by, I was one person's 54th doctor. And so we come from a very humble place and also very innovative space. So we're not going to just be talking about avoiding gluten and, healthy diet. I mean, while that is so foundational and so important, we're really going to highlight today, what I call this presentation is like common interferences to healthy digestion. So basically, we're always looking at, in the light of good treatment and all these smart doctors, what are the roadblocks and what are the obstacles from our patient's ability to self-regulate and heal? I'm a naturopathic doctor. I absolutely believe in our innate ability to heal. However, I think we live in a very interesting and unique time where our bodies are very stressed, and we have to acknowledge those stresses really so our bodies know what to do. So I'm going to be highlighting in this talk, we'll, of course, talk about the vagus nerve. Whenever we're talking about digestion, we have to think about the vagus nerve. And then we're really into bile and lymph and how that also ties into overlooked parasitic infections. I would say parasitic infections are some of the most rewarding infections to treat, but most often overlooked. And we can go into that as well. So we'll just dive in.
Beautiful. Yeah, you're definitely talking about some of the things that I think are often forgotten, and especially when it comes to elimination, detoxification, and helping the body get rid of the things that are blocking healing. So I'm excited. This is great.
Yeah, absolutely. And so again, we're going to talk about this concept in what we would call an interference field. We'll touch on the vagus nerve, bile, lymphatic flow, parasitic infections, and of course, I'll be talking about how all of these tie in together as I'm going through this. So one of the things that Dr. Klinghardt has taught me is this concept of an interference field. And so he studied neural therapy, which is a German injection technique. And this is a concept within neural therapy that we're looking at where there are blocks in our autonomic nervous system's ability to communicate. And so simply put, there can be either ganglion that are not communicating correctly, secondary to what we would call a neurotoxin. So a lot of the things that we're worried about in our environment are what we call a neurotoxin. So just break down the word. It's something that is toxic to a neuron and prevents that neuron from communicating effectively. So we look at toxicity in ganglia, which are like the fuse boxes of the nervous system that are really important communication centers. And then we also look at other interferences. So we look at what we would call a focal infection. The thing about focal infections are they're silent infections often because the immune system is not able to clear them. So we don't see these common signs of inflammation that would alert us that we have an infection. So it's kind of this silent, deadly infection that can be most often in the mouth, and we'll go over the mouth and the importance of the mouth and dental connection to our digestion. And then we're big proponents in looking at scars and how scars can actually, they're complex, right? Scars are usually from, either a surgical event or a trauma to the body, and scars can actually not only hold emotional trauma, but the cells in a scar have an abnormal resting membrane potential. So that's the way that the neurons communicate to each other. So there's kind of this low grade stress and dysfunction in a scar because of the electrical activity of the neurons and the cells in that scar tissue. And so that's one aspect. And then there's another aspect where when you think about scar tissue, scars can actually affect underneath, like the lymphatics and the fascia, and create disruptions of the flow of lymph drainage and even from an acupuncture meridian standpoint, it can affect the flow of energy there. So whenever we're looking at a person, especially when we're taking a history, we're always thinking about, okay, what are the blocks and interferences that maybe aren't part of our common clinical intake in conventional medicine, but identifying and alleviating things absolutely helps the body to self-regulate and heal. So that's the concept of an interference field, and I'll tie it in.
And real quick, Christine, I want to sort of highlight something here, because it's really important. With the nervous system, we talk about neurons. A lot of times we think of just the brain, right? We think of just neurons in the brain, but it sounds like you're talking about neurons throughout our entire body, either locally or systemically. Is that right?
Absolutely. So of course we have our central nervous system, and then we have our peripheral nervous system, and then we have these groupings of neurons, which are, what we call ganglion, which are these centralized areas in different parts of our body that really are important for the flow of communication. So there's like a sphenopalatine ganglion, and an otic ganglion, and there's cervical ganglion, and there's the celiac plexus when we think about, our digestion, and there's a pelvic plexus that regulates our reproductive organs. So there are these groupings of, ganglion that can be absolutely affected by pathogens that produce biotoxins that can affect those neurons, and also, of course, environmental toxicants. So mercury has an affinity, for neurons, other heavy metals, of course, and then
aluminum, right, is another big one.
Yeah, aluminum is huge. We look at, mercury is, of course, well known, but we feel like aluminum is one of the most devastating, heavy metals to our system these days. So yeah, that's a great point. And I think when we think about the gut, the gut has this huge nervous system, right? And we'll talk about that as well.
And real quick too, I want to tell you a story about the scars, because I've never heard anybody actually talk about scars in this way. And recently, when I was in India with an Ayurvedic master, we were talking about my history, and I thought, there's an interesting aspect. I bit through my tongue when I was like 13 or 14, and the area that I bit through, there's still a scar there now. And according to the Ayurvedic wisdom, that part of the tongue is connected through more or less an acupuncture meridian, if you want to think of it that way, but there's an energetic tie to the pancreas. And he was talking about how absolutely this has likely been affecting me my entire life because of that energetic tie and the scar and the trauma event that occurred. So anyway, just a quick little story about this, because I am finding absolutely that these things, these traumas and these scars can carry weight still years, decades later.
It's amazing. It's one of the most rewarding things I feel like I can do. When I see a new patient, we always ask for their surgical history, and their scar history. And we actually do something very outside the box. We can do a system called autonomic response testing that Dr. Klinghardt developed. And it's actually a form of biofeedback. It's a form of muscle testing or applied kinesiology. And he kind of put together a bunch of, philosophies and modalities. And then he also created his own. And one of the things that we look at we look for these interference fields in the body. And often one of the first things that comes up are these scars. And so we can treat them with injections. So we do neurotherapy, which we inject procaine, which is a compounded version of procaine. It's a local anesthetic. It's been used since the 1920s for scar therapy and neurotherapy, and has like a lot of magical properties. And then it helps to break down scar tissue and also reset the electrical potential, in those disturbed cells. And so scar therapy can be really fun, because once we treat them, I've had all sorts of funny things happen, like treating someone's mole removal, on their back, and their heart palpitations go away, or, treating their appendectomy scar and their gut pain goes away, or, women have, C-section scars, and that can be a really traumatic event, right? And so that can be, a whole host of emotions. And when I, treat that scar, sometimes there's this really visceral emotional release for women, and it's quite therapeutic and healing.
Amazing. I love it.
So moving on from interference fields. So just, again, I'm just trying to set the stage of things that we're thinking about when we're thinking about optimizing digestion. So, and I'll tie this back in as we go along. So we think about interference fields, and then, just to keep it real simple, we always are thinking about, when we're trying to heal the body, we're thinking about flow in the body, right? And so I'm going to connect on bioflow, because that's such an important part of digestion. And it's really a common theme in my patients, that they have sluggish liver, gallbladder, kind of stagnant stagnation in their bile in gallbladder region. And so we really want to get the bile to flow, and we can talk about that. And then the lymphatic system is one of the things that I love talking about. I think it's one of the most overlooked systems in the body, and it's one that we get the most reward when we have treatment strategies that address the lymphatic system, because the lymphatic system is a waste clearance system in the body, and it's also an immune surveillance area in the body. So it's kind of this intersection where, you know, we're always talking about pathogens and toxicity, right? And so this is the system that gets overwhelmed when we have chronic pathogens and also a lot of toxicants in our body. And we need to rely on you know, manual either therapies or different, you know, herbs or movement to really get the, you know, lymph system moving. So we'll be talking about these things. And then just, of course, tying into the vagus nerve. So everyone's talking about the vagus nerve, which is wonderful. You know, Dr. Klinghardt really has always educated me about looking at the vagus nerve. And, you know, when we think about our autonomic nervous system, right, we think about that balance between what we call sympathetic, or, you know, our fight or flight or freeze response. And then we also are parasympathetic. And the vagus nerve has a huge role in our parasympathetic nervous system, which is crucial. You know, and when I learned about the parasympathetic nervous system in school, we thought about it as rest and digest. So we need to engage our parasympathetic nervous system when we need to heal our bodies. And so it's the chicken and the egg. So we'll go through, like, it, unfortunately, some of our patients' parasympathetic nervous system has been hijacked because the vagus nerve is not functioning and communicating properly. And I want to kind of look at this from a different angle. We look at vagus nerve toxicity and infection a lot. And so I want to, you know, of course, there's all these, you know, people talking about how to stimulate the vagus nerve, which is great. But I also want to, like, look a level deeper, and why is the vagus nerve not communicating well to begin with? And it's typically related to vagus nerve toxicity and infection. So just a 101 on the vagus nerve, it's the 10th cranial nerve. It's the wandering nerve. It is really critical in our digestion, breathing, and heart rate. It's bidirectional. What that means is that our brain communicates to these organs, but also a big part of the vagus nerve is that what's happening in the organs, when it gets back, it gets communicated via the vagus nerve back to the brain. So it's just this unique, you know, two-way highway. And then the vagus nerve uses acetylcholine to communicate. So nerves always have neurotransmitters to help with communication. And so acetylcholine can be low in a lot of our patients. And, you know, we'll talk about all of that. So, so that's the vagus nerve. And then, so again, you know, going back to, okay, I want to talk about the vagus nerve and why, you know, it's infected and toxic, and I'll get to that, but also that connection with, you know, bile and lymph. And so the vagus nerve has a really, you know, big role in stimulating the liver and the gallbladder to produce bile. So when we think of bile stagnation, and we'll go over the role of bile in the body and why it's so important, we actually need the signals from our vagus nerve to stimulate through a couple different mechanisms. So the vagus nerves helps to contract the gallbladder, so moving bile out of the gallbladder and into the intestines. It's part of this hormonal signaling cascade to help stimulate bile release into the intestines, and it just actually stimulates the hepatocyte to actually move energy, move bile from the hepatocyte, which is a liver cell, into the bile. So the vagus nerve actually has a big role, you know, in the gallbladder's movement and production of bile flow. And then why is bile important? So bile is a huge, you know, and plays a huge role in not only digestion, but it's a huge exit route for the body. So when we go through liver phase 1, 2, and 3 conjugation of how we get rid of metabolic waste and toxicity, the bile is a huge role in that exit route. So the liver processes all these things and then shuttles them through the biliary ducts and into the gallbladder, and that bile has to move from the gallbladder into the intestines and out through the stool for it to be properly eliminated. Also, of course, a cool thing about bile is that we need healthy bile to have an optimal environment for an optimal microbiome. So if we have bile stagnation, we often will have an overgrowth of parasitic infections, bacterial infections, fungal infections. So it's a really important part of keeping our microbiome healthy. Of course, bile emulsifies fats. It's part of our digestion to emulsify fat and digest fat. Bile stimulates gut motility. So it also helps to stimulate this kind kind of nervous system movement of shuttling food through the intestines and evacuating, stool out of the colon. And so it's important. Some other interesting things about bile, I learned from Dr. Kelly Helderman that it's important for converting T4 into T3. So I see a lot of people with Hashimoto's or thyroiditis or thyroid hypothyroidism with a sluggish liver gallbladder. I see that connection a lot. And then, other reasons why, so we need bile for all of this. And then what happens, of course, I'm going to see the patients who have this bile stagnation. And there's all sorts of reasons, why that happens. And there's the technical term is intrahepatic cholestasis that I'd like to talk about. And that can be secondary to endotoxins from microbes in the gut, anything that causes inflammation in the body. We see this with estrogen dominance, as well as this is a common occurrence for some women in pregnancy, that this happens because of the hormone, the hormones that need to be metabolized through a sluggish system. When people have cholestasis, they'll have really itchiness in their skin. That's a sign that the bile isn't moving. We'll also talk about why, we need this importance of bile, but we'll talk about too, one of the things that I'm constantly having to navigate for patients is we really need them to detoxify appropriately. And we live in the land where we treat a lot of chronic infections. And one of the hard parts of treating a chronic infection is that we have to mitigate what we call a die-off response. And I'll go into that a little bit more as we talk, but a die-off response is when we are trying to target and kill, whether it's Lyme and co-infections, even a viral infection, a bacterial infection, a parasitic infection. These things, when we try to kill them, they produce biotoxins, and biotoxins can be very inflammatory for our body. And they can also have to go through that same phase 1, 2, and 3 detoxification that everything else does. So if you already have a compromised system and already a sluggish system, this kind of gets overloaded and then people get symptomatic. And how I help people through that is getting their bile to move, getting their organs of elimination to move, and we'll go through that. So when this Herxheimer die-off reaction is so commonly talked about, I just want people to kind of have an understanding of the mechanism and the liver. So we'll go over that. So this is Dr. Chris Shade. He owns Quicksilver. He's been a friend and he makes great products and has always been really passionate about talking about detoxification. So this is just, oversimplifying a liver cell. And again, I won't go into too much detail, but really this idea of there's a little code here and we have a toxin. So these toxins have to go through these little transporters from the blood into the liver cell. And this is where the magic happens in the liver. So the liver basically takes a toxin in phase 1 and activates this toxin. In phase 2, it conjugates it. And that conjugation step is really where we basically take this conjugated toxin, and then with bile and phosphatidylcholine, it moves through these transport proteins and shuttles out into the bile caniculi, which are basically the little tributaries flowing into the gallbladder, where the gallbladder is going to house all this bile. So when this is working right, it's beautiful, but we see patients when this is working, this is compromised and not working well. One of the things that Dr. Shade and also Dr. Holderman in a different way talks about this phase 2.5 detoxification. And if you have a patient who's just not getting better, one of the places that they're blocked is this step right here. And they call it phase 2.5, getting this conjugated toxin from the liver cell into the bile. And some people can't do that step because of endotoxins and inflammation in the body. And so then this other, bringing this all back to life, Dr. Shade has this, graphic as well. So this is when things don't go well. So why do people basically feel bad in a Herxheimer reaction? And this is when basically this step isn't working well for lots of different reasons that he goes into. But one of the, and I mentioned this already, but these types of things like estrogen dominance, pregnancy medications, endotoxins from gut microbiome issues or inflammation, of course, bile obstruction or liver disease is obvious, but these things can basically not allow these transporters to move conjugated toxins out of, the liver cell and into the bile. And what happens is, the liver cell will die if it keeps this all in the cell. So in the effort to save itself, it moves all of the stuff back into the bloodstream. And that's why people feel really, really bad, because all of this conjugated toxin and all of these bile salts are getting back into the bloodstream and circulated, and their skin can be itchy. They could feel nauseous. They could have a flare of symptoms. And that I just always like, when I'm talking about the gallbladder, I always like to highlight this, because I think it's a really elegant way to explain what actually a Herxheimer reaction is. So then other things, to think about when we think about bile is that, this is just a natural part of bile. That bile comes out of the gallbladder, and then it goes into this first part of the intestines, and it, moves its way through the intestines and hopefully out through the colon. It naturally, part of, this recycling, that it gets these bile salts get reabsorbed, to be processed again in the liver. The hard part is when we're in an environment when we're constantly bombarded by toxicants and biotoxins, some of the things that the liver tried so hard to get rid of get reabsorbed. And why they get reabsorbed can be multifactorial. It can be the liver, the system is overwhelmed. A lot of our patients who are sick don't have a lot of healthy, normal digestion. So they're more constipated. So they're going to be tending to, not have enough bowel movements to get rid of this. And so we're always mindful of how can we prevent at least the toxicants that are that are already trying to be eliminated in the bile don't get reabsorbed. And we do that through some strategies we'll talk about. The other part of enterohepatic recirculation that Dr. Klinghardt, I think, is really wise to remind us. So remember, these toxicants are getting conjugated, they're getting into the gut. They're not only getting reabsorbed potentially into, via, enterohepatic recirculation, but remember, we talked about this huge nervous system, in our intestines. And a lot of these things are neurotoxic or lipid soluble. And so if they're not moving at a rate and getting eliminated, well, they're going to get reabsorbed into the neurons. And then the neurons are going to deliver them, back into the nervous system, and that can disrupt a lot of our nervous system communication. So we use binders. We're really big into binders. If you take away one thing from this talk, just think about binders in your protocols. So binders are really the key to successful detoxification protocols. They're really annoying to take because it's away from food, and so everyone struggles with this, but I always say try to do your best. You don't have to be perfect, but ideally it's either 30 minutes before a meal or it's going to be 1 hour after a meal. And so we love things, and I go through this, I'll just highlight just all the binders we use. So we love chlorella. Chlorella is a superfood, and it has known research to bind to heavy metals, VOCs, pesticides, herbicides, mycotoxins. We work with a company called BioPure. They have a very clean source of chlorella. There's two types that we use, pyrenodosa and vulgaris. If you tend to be constipated, I recommend vulgaris to start with. It's a little easier to digest. And then pyrenodosa is a little bit stronger, but it can be constipating for some people. There's a brown algae that we sometimes use called Piscioclonia cava. That's really, it's also very nutrient dense. It has a lot more polyphenols, which are amazing for detoxification and also supporting neurotransmitters. Charcoal is great. We just use it more for acute situations because it can bind minerals. And so I see charcoal being great when people have either acute GI distress, if they're in a moldy home, if they just really need something quick, it can be very helpful. We use a zeolite product that's a really special form of zeolite that helps to also bind. I clinically see it really help with mycotoxins as well as aluminum. And then we've been working more with Cytodetox lately, and they are a liquid zeolite. We were a little skeptical at first of using a liquid zeolite because it can be dangerous with a high heavy metal count, but the Cytodetox, they've tested it for heavy metals, and we've been using it more clinically over the last 6 months, and it seems to have more of an effect. It can go deeper in the body, so it can go inside the cell or across the blood-brain barrier, so it goes beyond just the digestive tract. Um,
And Dr. Schaffner, I want to ask you real quick on those binders.
yeah,
Have you used, perfect. I was
yeah.
actually going to ask you about modified citrus pectin.
Well, yeah, yeah. So we have a whole host of things. So we use
I love it.
Enteros gel, which helps. It's a silica-based binder. It helps to mop up biotoxins in the gut from gut infections. Also, silica is an aluminum binder, so we use silica as an aluminum binder. Microsilica is a silica with a thiol binder that helps to bind metals in the gut. Modified citrus pectin we really love. It can help with lead and heavy metals. Also, it can support the immune system. We use Dr. Elias's Pectisol. We use a ton of humic and fulvic acid. I love this because it's also a mineral, so it has lots of minerals, and then it's known to also reduce glyphosate in the body, which is the active ingredient in Roundup. And then other favorites, again, I'm just sharing my experience with ART and with treatment protocols. Often I'm prescribing 2 to 3 binders throughout a patient's treatment protocol. And the little equation is, as we're basically killing things, we want to make sure that we have our routes of elimination open and enough binders to support biotoxins, endotoxins, mycotoxins, heavy metals being shuttled out of the body. So I love biobotanicals, GI Detox, Quicksilver Ultra Binder, and then cholestyramine is actually a medication, but it's when people have mold illness and are really sensitive to mold, I've seen this be helpful. So did I miss any binders that you were thinking of, Jason? Those are the ones that I have,
No, those are great. Yeah, it's a fantastic list. I use a lot of those myself. And so I love the humic and fulvic acid. I haven't used the zeolite as much as you guys have, but I know it's been on it's like one of the main things you guys use. So it's
yeah,
something that I know I actually probably should be working in a little bit more because I've
yeah,
heard so many great things.
yeah, absolutely. I think it's a great tool, and rotating them, and people are going to need different things at different times, but really empowering your patient to use binders, because binders are really, as I mentioned before, they're going to like totally allow you to be successful and to get people out of acute reactions, which of course we always are trying to prevent.
Absolutely.
And then, I can't forget, as a naturopath, I, am a firm believer in castor oil packs and coffee enemas. Castor oil packs are going to be wherever you apply castor oil, you bring lymph drainage and circulation to that organ. So it's really a great, gentle way to move bile and to support the liver. Some people put them over the abdomen too to help with constipation. And then coffee enemas are not only a great way to evacuate, the bowels and help with constipation, but it really stimulates bile release. And then you get the, basically the toxic bile out of the body. And I can't tell you how many people feel better from a coffee enema, from clearing brain fog to helping with pain, for helping them successfully navigate through like a hard protocol. So we love these things. They're part of kind of our patient's lifestyle while they're going through treatment. So then I'm moving, so I just talked about bile, and hopefully I shared some pearls around bile and how bile is really important to address and to keep flowing. And then this is a little unique to kind of our understanding. So again, we're really big into the lymphatic system, and the lymphatic system is this whole body-wide system, that we, really need to clear waste out of our body and to also help our immune system. And Dr. Klinghardt had a German, basically student teach us a form of lymph drainage that we use at Sophia. And, there's a lot of different traditions using this. So it's just, she kind of put together some ideas, but it's this idea when you have chronic inflammation in the gut and your gut isn't healed, you can have this buildup of lymph between the intestines and the abdominal wall that she coined radix edema. So it's basically kind of this buildup of lymph in the abdominal wall. And this, the lymphatic system is almost like a hydraulic system. So if you have kind of congestion in one area, it's going to affect other areas. So we help people who've had, a lot of issues really drain the lymph in the abdomen first. And that allows also their head and their neck and their extremities to drain. And it also offloads some of the pressure in the system and the intestines to help the immune system work better and to things for things to flow better. So we call it Sophia Matrix, and our massage therapists work pretty like, when we think about lymph drainage, sometimes it's the Vader technique that's really superficial, which serves a purpose, but this is deeper. So this is like a deeper technique where we're working on the abdomen first before the therapists are going to the head or the neck or the extremities. And then, if, you can't obviously come to Sophia or someone's not doing that, mine abdominal massage, that's a more of a female technique, but it is another technique where they really work on the lymph system in the abdomen to support the reproductive organs, but it also addresses like the whole abdomen. And then I also think castor oil packs, at home could be very helpful. So this has been one of the really rewarding things that patients find when someone really works on their abdomen, they feel a lot better. And then, we talk about all the things that can create stagnation in the lymph system. And then I wrote abdominal scars. We've already talked about scars, but I just want to presence that scars can affect lymph drainage. And this is just, some visuals, so it can affect the fascia, the lymphatics, the nervous system. Emotional trauma, of course, can be, stored as a cellular memory, and that can create blockage in the flow of lymph, believe it or not. And then we use neural therapy to help break down that scar tissue that I mentioned before. But if you don't have access to somebody who does neural therapy, you can use shea butter, or we have a cream that Dr. Marco Ruggiero created for us called Sophia Flow. It has a probiotic in it that produces something called macrophage activating factor, which it's a peptide that supports our immune system. So remember, when the lymph system is impaired, it can be also because the immune system is working hard. So this is just, a really wonderful tool to help decongest lymph and also to aid in the breakdown of scar tissue.
And Christine, am I correct in saying that, basically what I'm hearing with the way that we need to think about healing and the removal of all these waste products is we kind of need to work backwards. We need to make sure that our elimination technique or our elimination organs are working effectively before we start to loosen things up and get them into circulation. Is that a fair assessment to what you're kind of alluding to here?
Absolutely. As a naturopath, we're always thinking about organs of elimination and supporting those. And absolutely, I think, the body wants to be healthy. And when our organs of elimination get overwhelmed, then things start to break down. And I treat chronic infections all the time, and I see, how detrimental they can be to a person's body. But when I really reflect on it, I think, our immune systems are meant to engage with our environment. We're meant to, we're more microbes than human cells. We're supposed to kind of co-evolve with pathogens. However, I think the toxic environment is just this extra weight on our immune system that creates a lot of just problems, that we are more susceptible to opportunistic infections. So yes, elimination is like really important, and we are always looking at the exit routes of the body. I would never detox, somebody from heavy metals if they're constipated or, they're not hydrated, or, we have to have these basic parts of our body functioning so things can actually get eliminated properly and we don't stir things up or create more damage.
Makes sense.
And then when we're talking about the lymphatic system and the gut, I also always we talk a lot about the tonsils in our office. And I would say, Jason, like 9 out of 10 of our patients have some type of what we would call tonsil interference field. And the tonsils are actually part of the gut associated lymphatic tissue. So the tonsils kind of sit at the base of the throat, and they have an impact on our brain as well as our gut associated lymphatic tissue. And just think about it, when, we are inhaling things or eating things, this is kind of our first immune system contact, with food, and it can have a whole effect on our immune system. So I just always like to talk about the tonsils. I have another slide here. And when we think about the tonsils, it's not only these palatine tonsils that if you had your tonsils removed, you most likely had these removed and potentially the adenoids, but we have this whole ring of lymphatic tissue in our throat that's really important. And it's really, it's one of the most common interference fields that we see in patients, because if this area has been chronically infected from strep, viruses, even Lyme, if it's affected by dental infections, this chronic irritation and inflammation can be problematic not only to our gut, but also to our brain. And I'll talk a little bit more about that. So, but the tonsils are part of the lymphatic tissue. They absolutely have a role in gut health. And if your gut health, in spite of so many wonderful things you're doing, you're not getting there, think about this area that might need to be addressed. I just kind of threw a slide in here because the lymphatic system is part of the lymph system in the brain. I love talking about the lymphatic system. It is a waste clearance system that only happens when we sleep. It was only discovered in like 2015, but basically our brain shrinks at night to make room for the flow of lymph. And why I put this here is because that lymph has to drain through our cribriform plate, which is that place in our nasal passages where we're in contact, basically with our brain. And so that lymph drains and then it goes through the tonsils. So if that area is not working well, that can create basically congestion in the lymphatic system, and then we don't clear toxicity from our brain as well. So,
I mean, let me pause you right there, because that's a really profound thing that we're talking about. Not to really create any fear here, but when we start removing tonsils unnecessarily, and there's a lot of issues with any of the tonsil area, I mean, I'm immediately making a connection with Alzheimer's and dementia and some of these other things, because these waste products are not going to be cleared from the brain on a continuous ongoing basis for 40 or 50 or 60 years. Now we have this buildup of waste, metabolic waste, toxic waste, and that sort of sets the stage for mitochondropathy, right? The mitochondria sort of failing to function well. Then we get these plaques and this buildup, and then it's just this cycle, and it all has to do with clearing the toxins from the brain and these interference fields that you're talking about. So it's quite fascinating how something as what we used to think of as benign as tonsils can have such an amazing impact on the body.
Yeah, it's so true, Jason. And it's one of these areas where, chronic illness can be really complex, but we can kind of simplify things in some ways. And, I think a key to a healthy brain is to have the system functioning right, so we need, great sleep. And as you see, in this, in this basically image, that lymph is flowing along the arteries, and then it's basically, these are astrocytes that are controlling the flow of lymph and removing these wastes. And then if there are injuries in the body, this is why traumatic brain injuries are so detrimental to the brain, because they affect the lymphatic system. And so, but if there's injury or just an overwhelm in the body, this system doesn't work as well. And guess what? This stuff builds up, and they found that actually this is amyloid beta gets cleared out of the brain through this pathway. So as you mentioned, Alzheimer's or dementia, there's this buildup of basically not only metabolic waste, but other environmental toxins plus amyloid beta, and that can lead to cell death in the brain, and then that can lead to symptoms. So it's really, really important. I hope that we talk about it more and more. I think that there's so many tools to help have a healthy lymphatic system. And, the tonsils, just to share one other thought that's coming, there's this kind of like epidemic of children who have what we call PANS or pandas. And Dr. Vostani, who has Cyrix Lab, he shared a paper with us that showed that if you have a strep infection or chronic infection in your tonsils, that is an entryway for what we call Th17 cells to migrate through the cribriform plate into the brain and create microglia activation and inflammation in the brain. And these children who have these conditions have really a lot of neuroinflammation, and it's so sad. They can be very angry and inflamed and very violent even. And, I am a firm believer. I'm, a naturopath. I don't want people to just take out their tonsils, but believe it or not, and sometimes these children are people who have so much neuroinflammation, or some of our Lyme patients, we actually recommend taking out the tonsils to get rid of that reservoir of diseased tissue and chronic inflammation. That's really a portal to brain inflammation. So everyone's individual. You have to kind of absolutely look at the whole picture, but it's an area that I've just learned to focus on, because it's just so common in what we see.
That's beautiful. I'm glad you sort of highlighted that, because it is important that not everything is bad, but we have so many of these unnecessary, and that's really the differentiator, right? And perhaps you're going to get to it, but I would love for you to comment on, if somebody does have their tonsils removed or have had in the past, what can they do to sort of help stimulate the lymphatic flow that may not happen so effectively?
Yeah, so with the tonsils, One of the things, if you get a tonsillectomy, so often, we have 5 rings or 5 lymphatic tissues in Waldeyer's rings. So often you just get 1 or 2 of them removed. We have people, we do neural therapy, so we can have scars, in, the tonsil area. So we actually do intraoral scar injections and, alleviate the scars in that area. But, definitely different gargles can be very helpful. We use, things like there's something called HOCl or dental SOS. That's a hypochlorous solution that we love to gargle with. That is a really anti-infective and can really help with lymph drainage. And then I'll go in more depth to Jason. Opening up this lymph channel downstream can absolutely help with drainage from the brain with or without tonsils. So I'll share more about that. We're in, where I'm going here is going back to the vagus nerve, because we're kind of now going to be talking about, we talked about the lymph in the abdomen, we talked about the lymph in the brain, and then we're going to talk about the vagus nerve and the connection of how to, basically, this is a key part of healing our digestive tract because of all of its, communication to our digestive tract. So, one of the things that I want to highlight is that, we don't need to just restore communication. We really have to get the things that are basically, we have to get the toxins and infections out of the vagus nerve is basically what I'm trying to say. So if we have impaired lymph drainage in the cervical lymph nodes, this can also impact the vagus nerve. And so how that is all connected is that Michael Van Elzacker, he's from Stanford, and he has this vagus nerve infection hypothesis that I think he's really right on, and it's a really great communication tool. That he says that this chronic fatigue pattern or the sickness syndrome is when basically viruses, bacteria, or glial cells are bombarded by these basically viruses or bacteria bombard the nerves or the glial cells and create all these pro-inflammatory cytokines. And so what I want to share with you is that we looked at the vagus nerve, kind of goes right here, right? So we have the tonsils, we have the cervical lymph nodes, we have the vagus nerve in close proximity. And so I'm saying, let's heal the digestive tract by healing the vagus nerve. And so offloading infectious causes of why the vagus nerve isn't communicating well. So we have to look at, a lot of my patients have cervical lymphadenopathy or swollen cervical lymph nodes, and that can be secondary to viral infections, Lyme and co-infections. But we really have to decongest this area, not only to heal the vagus nerve, but also to keep the flow of lymph coming out of our brain, right? So the flow of lymph in the lymphatic system travels through the tonsils and then downstream in the neck. And if this area isn't flowing well, again, it will back up and we're not having that proper lymph drainage. So that's basically what this slide is saying. And then Ruggiero, who made our flow cream, and Bradstreet, who unfortunately he died tragically. He was a wonderful doctor who treated children with autism. They looked at the children with autism and they found that they had a buildup of fluid or lymph in their brain. And by basically using ultrasounds and different creams to decongest the cervical lymph nodes, they helped them remove the buildup in the brain. So I just wanted to share that, and their paper is listed here. And then when we think about infections in the cervical lymph nodes and the vagus nerve, so again, why is the vagus nerve not allowing the gut to heal and function optimally? It's because it's typically infected, and the infection basically creates cytokines and inflammatory responses, and it's not allowing us to produce acetylcholine and get into parasympathetic mode. So we look at the bacterial infections like strep and staph. Bartonella is one of the co-infections of Lyme disease that absolutely creates the cervical lymphadenopathy. Lyme or Borrelia can, of course, affect all of this. Viruses are known. Van Elzacker talks about more of the viral contributors to vagus nerve infection. So Epstein-Barr virus, this is why it's problematic, or the herpes family. Parasitic infections, so toxoplasmosis, leishmaniasis, coccidiomycosis, which is a fungal infection. Dental infections I'm going to tie in a moment. And then this is just, Van Elzacker, his vagus nerve hypothesis. I'm just recapping that any infectious agent with affinity for nerve tissue can affect the nerve communication.
And real quick too, I want to chime in on this,
Yeah.
Christine, because you're mentioning some of these infections, whether they be bacterial, viral, or parasitic. There's so many other things too. Like we talk about these common ones, right? And these are semi-common when it comes to infections. But there's human T lymphotrophic virus. There's we have so many of these infections, and sometimes it's hard to even think about those as being contributors to our issues, right? So I just want to sort of I just want to highlight the fact that there's stuff that we don't even know is there so often.
Yeah, and you mentioned the retroviral infections, which we're absolutely treating and tracking at Sophia. And the mind-bending thing about retroviruses are they're exogenous, right? So there can be retroviruses that we get exposed to, but also I think 6 to 8% of our DNA is actually endogenous retroviral DNA that can be activated from stresses, and then we're basically internally replicate.
Generating, right?
So it's, the more I know, Jason, the more I'm like, I have, but I try to, we help a lot of people, and how do we help a lot of people? Not knowing everything, right? It's like,
absolutely.
we also break down, these simplistic foundational properties that how does the body, eliminate, how do we alleviate stress, physical, chemical, environmental, emotional stress. And really the body is so wise and intelligent. And I have so much to learn still about the body, but it knows how to heal. It's just we have to help alleviate at least a threshold of stress for it to get there. And so I'm just really excited. I mean, I'm only 10 years into practice, and I'm so excited to see what the next decades are going to look like as technology gets better at identifying these things.
And that was kind of my main point too, is that I think a lot of the times we look at this list and say, well, I don't have strep or Bartonella or Lyme or Epstein-Barr. I've either been checked or it's just never been an issue. And so the main thing I'm saying, for the listeners too, is that sometimes it may not be one of those. It may be something else that we don't really have a great way of identifying. And so to your point, which is a very, very important point, the key is not to go around trying to figure out what's wrong with us, right? Or what we're infected with necessarily. Sometimes the key is to open up the channels, to open up the pathways, to remove the blocking ability of our natural ability to heal, right? And take care of these things. So, which is what, of course, this presentation is all about, which is why I love it so much, because it is such a key concept that I think sometimes we don't highlight enough, that if we just remove the blocking factors, then the body has such an amazing ability to revitalize, regenerate, and stay in balance.
Yeah, no, thank you, Jason. I absolutely agree. And just kind of some other ideas to kind of help heal the vagus nerve on our website. Dr. Klingert does the self-lymphatic drainage massage. So you can manually help to basically move lymph in your neck, and that can be really helpful for restoring lymphatic drainage and help starting to clear up what needs to clear up in the vagus nerve. And then we created this flow cream that you can do it without the flow cream, or you can do it with the flow cream. I've seen a lot of cervical congestion get alleviated with adding the flow cream in. And then let's touch on the teeth. So the teeth are really another big factor when we think about healing the vagus nerve, and when we think about maybe an interference field that's keeping the body from healing. So this is the acupuncture meridian chart, which each tooth is connected to an acupuncture meridian. Also, the teeth develop from ectodermal tissue, so it's the same tissue that our nervous system develops. So there's this connection between embryologically between our teeth and our nervous system. So we're, looking at basically, there can be a correlation. Let's say somebody has a chronic bladder infection and they have a root canal tooth on tooth number 9. That chronic bladder infection may not fully recover or heal until we alleviate and get rid of the interference on tooth number 9. So there's that, again, we're seeing people who don't get better. So this is some place, if you're stuck and you're not getting better, to absolutely evaluate. We, of course, advocate for a metal-free mouth. Amalgams have a mixture of mercury, silver, tin, and copper. obviously mercury is one of the most neurotoxic substances on the planet. Somehow dentists thought it was a good idea to put it close to our brain, but it's not a good idea. If you've had an amalgam filling, you've had absolutely mercury in your body. We have mercury in our body because we live on the planet and there's so many routes of exposure. But one of the first steps that we do is to help people safely remove amalgams if they have not done that already. Our hands are very tied in treating people while they have amalgam fillings because they're constantly getting exposed, and we're trying to eliminate neurotoxins. And one of the first steps of detox is avoid exposure. So just a plug for always. I'm still amazed how some patients who've seen amazing doctors still have amalgams when they come to us. And I think the knowledge is getting there, but I just don't overlook this.
I think that's just it. It gets overlooked, right? Like
Yeah.
they'll know it's there, but I think the lack of recognition of how important it is to
Mhm.
identify that as a contributing factor is just not
Mhm.
quite there.
Yeah, absolutely. And then root canals. Root canals are dead teeth. So these root canal teeth are the teeth that basically the root and the nerve were taken out. Non-biocompatible material was often stuffed in the tooth. And then sometimes even amalgam, unfortunately, is put there, or it's the tooth is crowned if needed. And what, dentists say, oh, this is a sterile environment, but this is not a sterile environment. Over time, this can harbor infection, and then microbes can get into the tubulin of the teeth. And then, cardiologists know that, that our oral health is so important to our heart health. We know that the oral microbiome has a huge effect on us systemically. And so if you have, chronic illness and if you have a mouthful of root canals, please consider safely removing them. I know that sounds drastic, but if you don't have your life and your health, you consider this. And why I'm bringing it into this conversation is because, just think of the mouth and the proximity to the vagus nerve and those cervical lymph nodes. So if you have mercury, you're inhaling that's infecting your tonsils. If you have root canals, that's affecting all of these lymph nodes, and that can affect the vagus nerve. I just put, this is just always like a little interesting thing. So if someone always has like right-sided symptoms, let's say, I always make sure there's no focal infection in the mouth on the right side. And you'll be surprised about how sometimes people have a problematic tooth on that side, and then we address it and their body gets better. Cavitations are basically often when a wisdom tooth is removed and this area doesn't heal, and a cavitation is an area of diseased or necrotic bone. It's a reservoir infection. So when biological dentists go and remove this tissue, they clean it out with ozone. They use platelet-rich fibrinogen to help heal this. And let's say they send this into the lab, which DNA Connections does, look at this, there can be viruses, amoebas, bacteria, Bartonella, in this area that the immune system can't get to and heal. So this can absolutely be, remember the wisdom teeth are kind of here. So you have cavitations in this area that absolutely can affect the cervical lymph nodes, the tonsils, the vagus nerve. And then interestingly enough, the wisdom teeth are on the small intestine, circulation, and endocrine meridians. So if someone has chronic digestive issues, I always work with a biological dentist to see if this is an issue. So basically, I just talked about the vagus nerve, bile, lymph, and then, I know we need to wrap up, but I just want to highlight parasitic infections for a few slides. Parasitic infections are very common. You do not need to go to a third world country to have a parasite, although that is one of the, known exposures. Parasitic infections are, they definitely, we're meant to engage into our environment. And then I see people who tend to have more immune compromise and opportunistic infections in their body, can't clear this, and this can be a very problematic issue not only for our digestion but for us systemically. So this was just interesting from the CDC. The perception that parasitic diseases are no longer relevant or important is a major impediment or implementing currently unavailable control and preventative strategies. So they're just saying like, hey, we shouldn't neglect this could be more problematic than we think. Symptoms of parasites can be all sorts of things, right? So any digestive issue, it's it's amazing how many people see worms, what they think are worms in their stool. It absolutely can have a mental health component as well. And then there's all of this mast cell activation syndrome and all these people who have all these sensitivities and allergies. And, parasites can make us more prone to histamine and mast cell activation. And, I have a naturopathic patient, and she was able to test herself, and she grew up on a farm, and she had anaphylaxis to certain foods. And then when she started treating and eliminating parasites, her food allergies and her anaphylaxis went away. And so I think sometimes we focus too much on food allergies. Well, of course, you don't want to put fuel on the fire, for sure. But why are we reacting to certain foods? It's typically because there's inflammation in the gut secondary to chronic infection like a parasite. Just briefly, parasites, we can have protozoa, we can have helminths or ectoparasites. Protozoa are going to be like the microscopic parasitic infections. They behave a little bit more like bacteria. So it's going to be more like the entamoebas, giardia. I treat a lot of babesia. Babesia is one of the co-infections of Lyme. It's an intracellular protozoa infection in the red blood cell.
I see a lot of giardia. What's your guys' go-to for giardia? And how?
Alinea. Usually we use the drug Alinea. So giardia is very common. We use herbs, of course, but there is typically, if someone, in naturopathic medicine, we have to meet the force of intervention with the force of the pathogen, right? And
Right.
parasites they're really adaptable. They're really smart. They are really hard to treat, but they can be treated for sure. You just need to, I think what happens is people use too weak of interventions or not
Right.
enough, or they, it takes
Or
constant.
it's not consistent, right?
Exactly. And so we'll use herbs that I'll go over, and then we work with a doctor, Dr. Simon Yu. He's a medical doctor out of St. Louis, and he wrote a book, The Accidental Cure, and he talks about how he helps so many people by addressing parasitic infections. And so we've modified his protocols, but we tend to use higher doses for a longer time than what would be recommended by a conventional doctor.
Makes sense.
And then helminths are going to be more flatworms, roundworms. I mentioned here ectoparasites because this is really, where Lyme disease, is kind of categorized. And Lyme is, really an epidemic. There's all sorts of reasons why, but it's not just transmitted from a tick. It can be fleas, lice, mites. There's some, conversations about sexual transmission of Lyme. I don't say that to freak people out because it's not just about the bug. It's about our terrain and our immune system. But just know if you're suffering from a chronic illness, you don't have to have the bullseye rash and a tick bite to be to have an exposure to Lyme or co-infections. And then tick-borne infections can be all of these things. So Borrelia, Babesia, Bartonella, Ehrlichia, Anaplasma, Rickettsia, Mycoplasma, Chlamydia, Pneumoniae. They're co-transmitted usually with Borrelia. And why Lyme is so problematic, it's a multi-systemic illness and affects every system in the body. It absolutely can be treated, and people can absolutely be, become better. But I think Lyme is at times the thing that's creating the immune suppression and allowing for the opportunistic infections that we're trying to clear up. So why are we susceptible to parasitic infections? And I just kind of mentioned this: Lyme, retroviruses, mold. So, again, parasitic infections are opportunistic, and, they typically are a symptom of something else. However, we need to treat them. Dr. Klingert also talks about how parasites are pollutant sinks. And what that means is that when we have a high environmental toxicity burden, we're going to be more prone to grow candida and also parasitic infections because they sequester those things out of our environment. And then that, when we treat parasites, we also not only have to treat the parasitic infections, but sometimes as we're treating and killing parasites, and they can release from themselves heavy metals or Lyme or viruses. So it's kind of this really interesting ecosystem that we're always working with. And then these are just the common ones I see in practice, highlighting liver flukes, especially with when we think about a congested gallbladder. So think about all the things I talked about, but also think about if you have a sluggish gallbladder, you could have, can be a breeding ground for bugs. And so part of alleviating liver gallbladder stress is also alleviating parasitic infections. Stool testing is not perfect. You definitely miss people's infections if you just use stool testing alone. You have to look at clinical history and symptoms. I like the GI map test. I like diagnostics. Para-wellness is Dr. D'Angelo's lab. He looks in the microscope. He does a great job. Todd is a friend and he developed a questionnaire. In basic blood work, the eosinophil, if you do a CBC with differential, the eosinophil is a cell that's responsible for basically clearing parasitic infections. So if it's above 2% and you have clinical signs of parasites, that can be, a clue. Also low alkaline phosphatase, low B12, low iron. So parasites prevent absorption of nutrients. So the parasites are getting those vitamins and minerals rather than yourself. And then the common thing, so if you have a patient who has symptoms around the full moon, and it is very common if you start asking, the full moon can be a time when basically the water in the parasites basically expands. They're going to be more irritated, irritable. They're going to need more nutrients. Also, it's a time for some parasites that they actually, procreate. And so there is sometimes a flare of symptoms in patients when it's the full moon. And so we often also do our treatments and make sure that we're covering patients with herbs or medications around the full moon when we're going through parasite treatment.
And I just want to highlight something here too, because this sounds really bizarre and woo-woo to a lot of people sometimes. And the moon is interesting, right? We actually have Dr. Gerald Pollack's work on water and how the moon has affected the electrical properties of water. The term lunatic comes from this phenomena where we have a full moon and people just seem to be acting a bit more strange. And then, of course, if you talk to any ER nurse or doctor, there's just a wave of things that happen on full moons, right? So even if we don't exactly know how the mechanisms are working with all this stuff, it's very, very obvious by just looking at the research and asking around, this actually does happen.
Absolutely. And, my role, I always see myself in, wearing different hats, but our patients teach us every day, and I'm an observer in a lot of ways. And even if I didn't, understand this or believe this or whatever, it's so clinically true, that we have to just acknowledge that. But
absolutely.
So just some common antiparasitic strategies. We use herbs, mimosa pudica we love. We'll use suppositories. Suppositories are a great way to get medicine into the colon and also into the lymphatics and into the liver gallbladder. Neem is also another one. We'll use ozonated oils, or fig is a natural antiparasitic. Aromatabs are these essential oil tablets that Dr. D'Angelo makes. They get compounded. We'll use medications often. So biltricide, ivermectin, pyrantyl panamoate, albenza, lineum, mepicrine. You got to work with a doctor who knows what they're doing with those, but that can be a very rewarding strategy. I just put this here. Dr. Klinghardt met these Russians by the name of Gubarev, and they created these enemas that are like eucalyptus and all these other kind of antimicrobial, antiparasitic herbals that you can use in an enema. So that can be a strategy. Parasites can affect the lung, and so sometimes we also use a nebulizer that puts medication in the nebulizer that the patient will inhale, and it locally targets the lung. So we'll use iodine, it's antiparasitic, or Alimax is a garlic extract. And then treatment takes time, persistence, consistency. This is mimosa pudica, the plant. I've already talked about Herxheimer reactions. They're really important when we're treating parasitic infections. So the key to that is binders and keeping your routes of elimination open. Just some favorite detox strategies from enemas, colonics, castor packs, lymph drainage, hydration, of course. The foot bath actually works. We see people, really do well with that. And of course, binders. And then, this is just something to think about. Don't think about the parasitic infection alone or in isolation. Think about it in the context of a whole overall immune system. And then I think, I just mentioned, and again, not to get too woo here, but, there is this kind of energy, like, is there parasitic energy in your life or, unresolved trauma? And there's this interesting kind of, again, this is what I see clinically, can sound esoteric, but there is when people are going through this emotional or physical battle with parasites, some emotional things can absolutely, come up. And so I just don't want to under acknowledge that, because if you decide to treat this and to support people with this, you also have to have tools and referrals to help them on an energetic and emotional level to really feel supported going through.
This is something I've 100% seen in my
Yep.
practice as well. And I think it makes a lot of sense because there is no distinction. There is no separation between mind and body. There's no separation between our emotions and our body. And the energies are interchangeable, right? So anytime we're going to impact the body, it's going to have an emotional impact. In fact, right now I have a new child, and my sleep is not fantastic. It's very disrupted. And I've noticed during the day, I'm a little bit more sluggish. I'm a little bit more depressed, let's say.
Yeah.
I'm not my normal self. So this is just something that we have to recognize, that the body and the mind and the emotions all affect each other. And so trauma, emotional trauma is a huge aspect. And I think I've seen a lot of correlation between individuals that struggle with proper boundaries. And if you think about the immune system as sort of this ultimate boundary between you and the outside world, and a healthy boundary, I've seen a lot of leaky gut with people that have boundary issues emotionally and mentally, and then infections as well. So I love what you said there. I'm glad you highlighted that, because it's something I've definitely noticed, and you'll even see it infection in the thought patterns, right, in the mind. And so if we have this negative bias, or we're, and I'm not saying one is causing the other necessarily. It could be chicken and the egg, could be both together, but it's definitely something to address as well, and to at least bring mindfulness to see if that's something that could be worked on.
Absolutely. And, there's just wonderful modalities and treatments. And, parasites have a consciousness and an energy, so they're going to be fighting for their survival as you are, going through treatment. And, it's really this kind of, very, complex interaction that we need to support people with, but it's one of the most rewarding things. And people absolutely feel less depressed, less anxious, themselves when they get through this. So,
Yep.
we kind of have to rethink mental health, but that's a whole nother conversation. So just, in closing, recapping. So just really always asking the reason, what are the obstacles that are preventing your patient from healing? Is there bile sluggish due to vagus nerve toxicity or infection, or secondary to parasitic infection? Is it the vagus nerve infected from dental infections or other stealth pathogens? And to heal the vagus nerve, remove infection toxicity and get the lymph draining in the neck. And treatment strategies should always aid in getting the bile and lymph flowing in the abdomen. So those are just some things to ponder. So I hope, I hope this is helpful. And I just shared some insights of course, what we see in practice, and what we, we're always evolving our treatment methods and modalities and strategies. But all of the things I shared are kind of tried and true methodologies and observations that we see.
Yeah. And we'll link to the flow cream as well, because I know that's a very unique product. I actually want you to, if you don't mind, give me some insight. You mentioned that the probiotic blend is sort of part of where the magic happens, right? But how does that stuff actually work if we're applying it to the back of our neck?
Yeah, so, it's been something we've worked with over the years. And Dr. Ruggiero, he's actually a radiologist. And so when we were developing the cream, he came in with an ultrasound, and we could see before and afters of where we put the cream and what changed in the body. And so it was really quite fascinating. And so it's a blend of, it's a probiotic that produces macrophage activating factor. It's a peptide, so it helps to stimulate our macrophages that help to clear viruses and other infections. So it's a topical way to do this. Viruses and cancer cells actually produce an enzyme called nagalase that inactivate our own body's ability to produce macrophage activating factor. So that's what creates the immune suppression. So we're aiding in a peptide that, is usually depleted in our chronically ill patients. And then it has other things like chondroitin sulfate, which is part of the extracellular matrix, vitamin D. It's in this phospholipid base. And so where we apply it, we apply it on the front of the neck often to decongest the lymph nodes in the neck and to get things draining. You can put it on painful areas. I've seen that work. It's not 100%, but it can absolutely help with pain. But what Marco would do when we did the before and afters with ultrasound, we showed less, swelling in the lymph, less swelling in the thyroid. We had a patient, we put it over their spleen and we saw more blood flow after the application. So it's just a really great clinical ally that we've been using, and it's just another really great strategy topically to support the lymph system.
And we've got the thymus gland here too, right? So it's probably working with the thymus gland.
The thymus gland is often, atrophied or not working as well as we age and as we have chronic infection. And so you can absolutely, the thymus gland is, in the sternal area. Thymus tapping actually is something that, can help engage the thymus as well. And then there's thymus peptides that we're also working with injectable to help recover people's immune system. So yeah, the Flow Cream has been really fun. It's been a really fun tool, and we're so grateful to have it for our patients.
Yeah. I mean, your presentation, I think people are going to probably have to watch it 2 or 3 times. I'm probably going to have to as well, honestly, because there's so much in there. And I think, what I really love about that, the fact that you're covering so many areas, is that so many of us struggle with health issues, and we're not, a lot of times people keep pointing to the same areas. You got to fix the gut, you got to fix this, you got to fix that. And we forget about all these other things. And they're so tied into what we're going through. You mentioned the dental aspect of health. And this was something that I missed for so many years. And then once it finally kind of clicked, I was like, oh my God, it's so important. This is a critical aspect to not only the digestive tract, but it's an instant route to the bloodstream. So it's so critical. So I think what I would encourage the viewers to take away is to, Christine is pointing to areas that you could focus on. If you're stuck and you're not sure where things are going wrong, it's not like every person has to do all of these things. You don't have to check all these boxes. But so many times, maybe it's a couple of these boxes that need to be checked, or there's just one area that has been so neglected and forgotten about that if we just address it along with the other things that they're doing, then things just move forward so much faster.
Absolutely. Absolutely. Just take what resonates with you and start there. And yeah, I just want to, give people hope. And there's always a reason, why you're sick. There's nothing is random. And we're just sharing some maybe, paths that haven't been uncovered yet for you. And you'll be surprised and rewarded when you start looking at these areas.
Absolutely. And there's such an intimate link between the lymphatic system and the gut, right? We have the gut associated lymphatic tissue. So this idea of improving the function of the lymphatic tissue is so critical to gut health. And the gut can't heal if the liver and the bile ducts are not functioning well. If we're not getting bile, adequate and sufficient bile flow into the gut, and we're not eliminating these metabolic wastes and other things that are impacting us. And so again, there's so much here, but it's so intertwined with what we're talking about in this roundtable. So Dr. Christine, I'm so grateful that you joined us. And I'm grateful that you and Dr. Klinghardt are working together to further this work, because it's so you And I know you guys work with some of the most challenging clients that have been struggling with things for years, if not decades. And so you guys are on the front lines, in my view, of some of the most important remedies to the things that we're dealing with today.
Thank you so much, Jason. I really appreciate this invitation, and I hope this is all very helpful. And we're so committed and passionate about this work. So thank you.
Absolutely. And again, we'll link to the Flow Cream on this page, so if anybody wants to give it a shot. It truly is a unique product. I see a lot of products, and I don't see anything out there like this. And I've done a lot of work with Ayurveda, and one of their big systems they focus on is the lymphatic tissue, and it's so critical in that system of healing to get the lymphatic system working properly. So this is all tying right into what you talked about today. And again, thank you so much for joining us, and we'll see you guys all in the next one.